everyone. Welcome to Hands-On Neuro Rehab's Hand Therapy Tools. Today we're going to be discussing cubital tunnel syndrome. How did I get it? How do I get rid of it? Do I need surgery? All that good stuff. So what is cubital tunnel syndrome? So cubital tunnel syndrome is inflammation of the ulnar nerve. Oftentimes this happens at the elbow, around here. About, I would say, around 80% of cases, but a lot of people have impingement sites in different places. That is the tricky thing with treating something with cumulative trauma within the clinic and at home. In different impingement sites for ulnar nerve impingements can be at the flexor carpi ulnaris muscle. The two heads can often swish it together and create a little bit of pain within there. You can also have it at Guyon's canal, which will give you different symptoms than cubital tunnel at the actual elbow. And then you can also have an impingement at C8 through T1, which oftentimes we refer to as like cervical radiculopathy, but that can also create a little bit of ulnar nerve related symptoms as well. So it's important to work with an orthopedic surgeon, a neuro specialist, neurosurgeon, or a certified hand therapist to kind of really figure out where that level of impingement is and to address it accordingly. So you got cubital tunnel. What are we doing about it now? Or for new therapists, PTs and OTs, we're learning about cubital tunnel. So what do? We see a patient with ulnar nerve pain. So things that we want to address. There are risk factors. What causes cubital tunnel? So oftentimes when people talk on the phone and the elbow's bent up for long periods of time, that can cause a little bit of impingement. Oftentimes people will sleep on this arm, fold it up like this underneath their pillow. You don't know what you're doing in your sleep. I'm just kidding, but it could be that could be impinging it as well. Some people type for long periods of time, and that could also aggravate that ulnar nerve and then can give it a little bit of like issues. Sometimes we have weightlifters as well that are doing heavy lifting, and then sometimes they can develop a little bit of tricep tendonitis or some joint dysfunction, and that can create a little bit of instability and put pressure on that ulnar nerve as well. There's a myriad of different things that can kind of create ulnar nerve related symptoms, and that's why a good comprehensive assessment is important for treating it and getting rid of it fully. What can you do now that we've addressed the different levels of impingement? Well, healing time frame is slow. So even if we release it surgically, that ulnar nerve is going to heal at an inch a month. That's very slow. So it takes time for your sensation to come back at the tips of the fingers if we're releasing down here and this was your level of impingement. So a lot of times we have to remind patients to kind of be patient with their rehab and with their healing time frame, because it will come back. It just takes a little bit of time. So give it at least 6 months before we really start asking a lot of questions about that sensation. But sometimes your doctor will also tell you up to 1 year to 2 years to get back to your sensation or get back your sensation. So it's important to be patient within that process. Ulnar nerve glides are very important for trying to mobilize that nerve and try to promote a little bit of circulation within there. There's some evidence that's effective for nerve glides, but a lot of massage within that area can also help promote circulation when you're healing. So making sure there's no scar tissue sticking around here if you've been released post-surgically, or if you're typing and doing a lot of activity, making sure that this is nice and flexible and then the muscles are nice and loose if we know that they're super tight compared to the other side, or we're a dominant righty or lefty. So those are things that we often do in the clinic. We'll do some manual therapy, we'll do some stretching or some taping just to go ahead and take some pressure off of those sites, just in case it's an impinged at a different site, like that flexor carpi ulnaris muscle or that elbow. Other things you can do for a cubital tunnel, like you want to do nice rhythmic motions. That's going to be soothing for decreasing pain, using aerobic activity. Walking and circulation can sometimes decrease symptoms because remember, it's cubital tunnel, it's cumulative trauma, like the ulnar nerve isn't breathing. So it's trapped within this space. It's not getting a lot of circulation because we've been bent up for a long period of time, or we've been doing a lot of activity, so it's nice and sandwiched. And it's like when you sit on your hand for a long period of time, like it's a little bit dead. It takes a little bit for some of that sensation to come back. It's the same thing with cubital tunnel syndrome. So it's going to take a little bit for that ulnar nerve to heal and a little bit for that circulation to kind of start going throughout that area so that nerve can feel a little bit better and those symptoms can kind of decrease a little bit. One of my favorite things to do for cubital tunnel is to address posture. So oftentimes, exactly how I'm sitting now, ignore me y'all, going ahead and sitting like this. So putting your feet on the ground and then making sure that you have a nice upright posture. For the ladies, chest out, boobs out. For the guys, making sure that your shoulders are nice and relaxed can kind of decrease pressure at that ulnar nerve, especially around here. And oftentimes we see it with a lot of people with texting neck and people that work a lot of typing jobs. You'll sit a lot of times like this and keep typing and typing. And those things can take a lot of toll on that ulnar nerve because we're sandwiching down here, we're sandwiching it at the elbow because we're sitting at this tiny desk. So posture is a really big thing, and doing some of those scapular muscle training and rows and lat pull downs, those types of stuff that we like to put in our exercise programs are really influential in trying to mediate some of like those symptoms for like cubital tunnel. And lastly, bracing. Love me a good cubital tunnel brace. So you can do things low profile, like using a compression sleeve and then putting a nice little sock in there. And that can kind of help with mediating some of that bend up at work, or sometimes when you're sleeping, just a helpful little reminder. Sometimes people are gonna need those hard splints. And then those are often used like when you really do bend up and that ulnar nerve does need a little bit of a break. So it holds the arm at least 30 degrees of extension, and that's optimal for having the ulnar nerve breathe and at least giving it the relief that it needs to help decrease some of those symptoms that you're getting within the hand. Do we need surgery? It depends. Like there's many different things that we look at as hand therapists. So when I look at a hand, I stare at hands all day. I look at the muscle atrophy. I look at the sensation. We look at the coordination of the hand. So have you been noticing you've been dropping items? Have you noticed that you cannot open pill bottles and water bottles as much anymore? Do you notice that you're starting to have a lack of thumb function? Our ulnar nerve is responsible for our lateral pinch. So the same thing we use to turn the key in the door in our ignition is our ulnar nerve. So when we have cubital tunnel, sometimes we lose that function. So it's really important to try and preserve that, because otherwise sometimes we'll need tendon transfers to try to regain some of that lost function if we wait too long. So it's really about how far along the muscle atrophy looks like, how far along your sensation is, if it's completely dead. What does your nerve conduction study say? There's many different things that we look at as a hand therapist in evaluating cubital tunnel. If you guys have any questions, or if you guys have any feedback, favorite things that you use for cubital tunnel, please put it in the comments below. And if you have any questions regarding your symptoms and things like that, please feel free to leave a comment below as well. We do offer a free consultation for services within the Central Florida region, but we do have hand therapy toolkits available for people that want to continue at home managing their condition, or if you need a little bit of advice, we do have consultation services through telehealth as well. You guys have a wonderful day. It is a bright, sunny day in Florida, so I'm gonna go make some patients happy. I'll see you next time. Bye.